London, the 1780s, you faint near the River Thames. A stranger sprints to the wall and grabs an emergency medical kit. Because yes, they hung these along the river, exactly like we hang defibrillators today. Inside the box, a pair of bellows, a long tube, and instructions to pump tobacco smoke into the patient. Not into their mouth, the other end. This was real, officially recommended medicine for about 40 years. And here's the truly wild part. It's not even the strangest device in history's medical bag. Today we're opening that bag, and a few of these things actually worked. Let's start 3,000 years ago in ancient Egypt. In a tomb near Luxor, archaeologists found a mummy, a woman missing her right big toe. In its place, a carefully carved wooden one with leather straps, a hinge, and real wear marks from years of walking. Scientists at the University of Manchester built exact replicas and tested them on volunteers missing the same toe. The result? Up to 87% of normal toe flex. A 3,000-year-old prosthetic passed a modern lab test. Point 1 for ancient doctors. But ancient doctors weren't just carving toes, they were drilling skulls. It's called trepanation, cutting a hole in a living person's head. And humans have done it for thousands of years. Sounds like a death sentence, right? Here's the shocker: the bone healed. In ancient Peru, where more than 800 drilled skulls have been found, survival rates eventually reached about 90%. During the American Civil War, with metal tools and real hospitals, skull surgery killed roughly half the patients. The ancient Peruvians were better at it. Some skulls even show several healed holes. Repeat customers. Meanwhile, in ancient Italy, the Etruscans were inventing the grill. 2,600 years ago, wealthy Etruscan women wore gold bands across their front teeth, holding replacement teeth in place. And some evidence suggests a few had perfectly healthy teeth removed on purpose, just to upgrade to gold. Dentistry as jewelry. A few centuries later, Roman doctors carried full surgical kits. One of them, buried in Pompeii in the year 79, held 40 bronze instruments, scalpels, forceps, bone levers, that look almost identical to a modern operating tray. The tools were brilliant. The theories behind them. Hold that thought. Around the year 1000 in Cordoba, a surgeon named Al-Zahrawi did something nobody had done before. He wrote an illustrated encyclopedia of surgery with drawings of over 200 instruments, many of them his own inventions. European medical schools kept it on the shelf for centuries. Around the same time, an eye doctor named Al-Mausili described a hollow needle that could gently suction a cataract right out of the eye. Modern cataract surgery? Also suction. He was about 1,000 years early. Then came the 1800s, when the engineering got brilliant and the ideas got weird. Pharmacies displayed medicinal leeches in fancy porcelain jars like candy. When leeches got too expensive, someone invented a mechanical leech, a spring-loaded robot worm. There was the scarificator, a beautiful little brass box that snapped out 12 tiny blades at the press of a button. The tonsil guillotine, and yes, doctors actually called it that. And my personal favorite, in 1819, the King of Portugal, who was hard of hearing, had a throne built with hollow lion heads carved into the armrests. Visitors had to kneel and speak into the lions' mouths, and hidden tubes carried their voices straight to the king's ear. A hearing aid, disguised as a throne. But here's the twist, the most famous medical device in history, the plague doctor's beaked mask, the one from the Black Death, isn't from the Black Death. There's no evidence it existed in the Middle Ages at all. It was designed by a French royal physician, Charles de Lorme, in 1619, nearly 3 centuries after the Black Death. It was only ever documented in parts of France and Italy, and most plague doctors never wore one. That herb-stuffed beak was built to filter bad air, a theory that was completely wrong. History's most iconic medical device is mostly a costume party legend, and the device that sounds the most fake. 100% real. In the late 1700s, 2 Scottish doctors invented a small hand-cranked chainsaw, a spinning chain of tiny cutting teeth, to help doctors work faster in difficult childbirths and later in bone surgery. The lumber chainsaw wouldn't exist for another 100 years. That's right, the chainsaw started out as a medical device. Sleep well. So, which one of these would you least want your doctor to pull out? The smoke bellows, the skull drill, or the robot leech? Tell me in the comments. And if you like weird history told in pictures, hit subscribe. Pip's got a new mystery every week.